Educating the patient on the etiology of periodontitis and the patient's role in its prognosis may be the most significant part of the treatment plan. After a comprehensive examination and a full mouth probing, I typically sit down with the patient and I explain to them the etiology of periodontitis as well as the patient's role in its prognosis so that I get a buy-in from the patient so that they understand how important their role in the treatment of periodontitis is. So typically this is a spiel that I use with the patient. Hey, Mrs. Jones, do you understand what the numbers that I just called out mean? Well, let me explain to you. So first of all, your teeth are embedded in bone. And on top of the bone are your gums. And typically, this is what you see on the surface, but what's more important are the bones that are holding up your teeth. So I put a millimeter ruler between the tooth and the gums to see how far it goes down. And 3 millimeters or less, those are good numbers. If it's any deeper, then it's not so good, because what's going on is that now you're starting to lose bone and now the ruler goes in deeper. Okay? Do you see how that could be a problem? So if this is your tooth and you start to lose bone over time, you can see where that's headed. So the question now becomes, what causes this progressive bone loss? Okay? We're going to talk about 3 different factors, but the main one, the primary one, is something called plaque. And I'm sure you've heard of this term, plaque, but do you understand what it means? Some people think it's food or hard substance, but it's nothing more than just the buildup of bacteria. That's all it is. And this bacteria forms everywhere in our mouths, and we do a pretty good job of removing it in most places, except right along the gum lines and in between the teeth. Okay? And that's why I just showed you how to brush along the gum lines and how to floss, because this is a critical part of removing the source of the infection that's causing your bone loss. Okay? And this bacteria, if we gave you a thorough cleaning today, it'll all come back in about 24 to 48 hours. And that's why it's really critical for you to floss at least once a day. Okay? Now, in addition to the bacteria causing the infections of your gums, smoking affects how your body fights off infections. So if you continue to smoke, that's going to have a critical impact on how well you respond to any of the treatments that we'll be prescribing. And third, genetics. Right? Sometimes it's how our body's made up and how we fight off infection that affects how we respond to any type of infections. Right? So if you have anyone in your family that's lost teeth early, chances are you are more susceptible to losing bone around your teeth. Okay? So this you can't really do too much about, but these 2 things we can focus on. Now, before we get there, first of all, let me tell you what you have. So the condition that you have is called periodontitis. It just means that you are losing the supporting structures of your teeth over time. And this periodontitis is what we call a chronic disease. Chronic meaning that it is a slow, ongoing process. And the amount of bone loss that you have currently, it didn't happen overnight. It's been going on for a while. And because it is a chronic disease, okay, it's such a slow process, you don't even feel that there's anything that's been wrong with your gums and your teeth. In order for me to illustrate that, I'm going to give you some examples of some well-known chronic diseases. One is high blood pressure, and another is diabetes. So now let's take high blood pressure for a second. If you have high blood pressure, do you go around thinking, oh, I feel high blood pressure? No, that doesn't happen. By the time you feel that there's something wrong with you, it's too late. Okay? Kind of same way with periodontitis. If you have periodontitis, you don't feel like that there's anything wrong with you, and by the time you have symptoms, it's probably too late to save your teeth. Right? So if you go see your doctor and your doctor tells you to do several things, they're going to tell you to cut out the fat in your diet, start exercising, and quit smoking, and take these pills on time. Now, what if you went back to your doctor and you said, hey doc, I love what I eat, I hate exercising, there's no way I'm going to quit smoking, and I keep forgetting to take these pills on time, but I want you to fix me up, doc. What do you think the doctor's going to say? Well, exactly. Well, the doctor's going to say that there's not much he can do for you. And in the same way, okay, there are things that we can do to help you out. But if you can't do this part and this part, okay, which is removing the bacteria in between your teeth every day and quit smoking, in the long term, there isn't a whole lot we can do for you at that point. Okay? And at this time, many of my patients are appreciative of the time that I spent explaining this to them, and they frequently tell me that no one has ever spent this amount of time discussing any of their diseases. You can use a version of my presentation and you can tailor it to your practice and your environment. You can extend it if you like. You can shorten it if you need to. I hope this will help you with your patient education and compliance. If you like this video, please subscribe to my channel.